So the next technique that we're gonna do will be manual lymphatic drainage. Okay, so the same protocol for the leg, yeah? The same protocol for the leg. Not really, still open for manual lymphatic drainage for the lower leg. Still open the terminus for 20 times on the top. And then after the 20 times of pump there, always remember to put an additional pillow on where the, because again, rise, right? Rest, ice, and elevate. No hydrotherapy, so I'm just gonna elevate it. For this one, it's gonna be tricky. So what I'm gonna be doing is, I'm gonna tell the client to put their hand on top of their inguinal area. Can you please put your hand in the, yes, around that area? Relax your hand. There you go. And then I'm gonna press on top of that hand. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. For this one, I am pressing a little bit more because his hands are there. So, but the hands would protect me from touching the sensitive area.
Sorry, what area is that exactly?
The inguinal, wherever your underwear is lining up. Where you the division between the pelvic and the thigh. That's where you want it to be. And then for this one, I'm gonna release it a little bit to cover, and then tell them to bend a little bit, bend a little bit. Perfect. And then underneath the knee, I'm gonna press the same. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. And then I'm gonna let it relax, fix the draping again. Then I'm gonna divide segment 1, segment 2, segment 3, segment 4, segment 5. So the same concept. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. And then I'll repeat it 2 to 3 times with the area, and then I'm gonna flush.
Yep.
And then that's it. That's the technique. So it's the same, but instead of the arm, it's the leg. Okay?
Is that lotion or no lotion?
I do it with no lotion.
Okay.
I do it with no lotion. So for joint mobs, the gist is there are different levels of the joint that you can move, and there's different versions. You have the sustained and the oscillatory. So the gist is, if the problem is flexion, you have to glide the joint the opposite way because it's like you're stretching the joint. So if this is the problem, then you have to glide the joint extension. If extension is the problem, you have to glide the joint in flexion because it's like a stretch in the ligament or in the joint. Now there are 2 types. We have the sustained and the oscillatory. The sustained it has 3 grades. It's like a staircase. When you move the joint, I have here I'm gonna show you in the camera just for the sake of like showing. The gist is, if this is the joint, we're moving it grade 1, grade 2, grade 3. Sorry, it's too low. Grade 1, grade 2, grade 3. Okay? Grade 1, grade 2, grade 3. Or grade 1, grade 2, grade 3. It's a gradual move. But for oscillatory, it's small, big, big, small amplitude. Meaning small amplitudes, then big, big amplitudes, then smaller again. So grade 1, it actually goes to grade 5. But it's not in our scope to go beyond that. That's why we're only going to grade 4. So the gist is, it's gonna be grade 1, grade 2, grade 3, and grade 4. And again, principles, you have to go grade 4, grade 3, grade 2, grade 1. The same with sustained. Grade 1, grade 1, grade 2, grade 3, then 3, 2, 1. You have to bring it back. Okay? Then, prior to doing that technique, you need to do a traction and distraction. There's a lot of explanation of this, but a simple way to remember is traction. You're just pulling the joint on a straight line, and distraction, you have to bend it a little bit to do a distraction. There's also an open and closed pack positions for this. Open position for the joint, meaning this is the most movable angle for the joint. And then the other one would be more of, that's the most restrictive. So if it's closed pack, it means it's restricted. If it's, what do you call this? If it's not really closed packed, then we're gonna have to do we have to find the open pack. So usually you have to open it a little bit. Let me give you one example on the table, and then the rest I can show you with clothing. So if I'm gonna do a posterior glide, okay, because let's assume that his flexion is problematic. So I wanna do the stretch in the front, so I have to put it towards the end. So what I'm gonna do first is I'm gonna open it on open pack. Step 1 for joint mob is do some traction. So I'm gonna distract it a bit. Can you hold it here, please? Just a little bit lower, and then I'm gonna go lower. Then I'm gonna just traction it, hold it for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then after that, I'm gonna start doing the thing. I'm gonna hold here a bit. I'm gonna find the joint. Once I feel that the joint is moving, and then I'm gonna be grade 1. Let's say it's sustained. After distraction, I'm gonna be doing grade 1. Grade 1, any pain or discomfort?
Yeah.
Grade 1, grade 2, grade 3. So I'm just pushing it all the way down. Then grade 3, grade 2, grade 1. If it's oscillation, look at the difference. I'm gonna be the same thing. You have to distract or traction first. Then grade 1, small amplitudes. Grade 2, bigger amplitudes. Grade 3, bigger amplitudes. Then grade 4, smaller amplitudes. And then I'm gonna go back to grade 3, grade 2, and then grade 1. Okay? You can even do that on the fingers and the ankle, the wrist joint, and so on and so forth. Okay?
Okay, yep.
So that's the gist of joint mobilizations. There are definitely more, but those are the common terminologies that we're gonna be using for this. Okay? So let him change so that I can show you the other ones. And then, yeah.